Hey everybody, it's Dr. Gaffney. Thanks for joining me again today. And today we're going to talk about the painful corns on the toes that hurt so bad and you just want it gone. So I'm going to share what has helped thousands of my patients and also cost-effective treatments and help you save money so you don't waste money on things that don't work. And also at the end, we're going to share a definitive treatment to resolve your corn for good. So stick around with us and we will get into it. Okay, and just remember, this is my disclaimer. This is not medical advice. This is for informational purposes only. This is not a doctor-patient relationship. So before we get into treatment, we have to discuss what a corn is and how it comes to be to understand the treatment. So a corn is a thick layer of dead skin on the toe, usually on the top of the knuckle there or on the sides between the toes. And it usually is your skin's response to pressure or friction. So the skin's responding, laying down layers of dead skin to protect the area so you don't get a wound. Now the corn is a symptom of the primary root cause problem, which is a toe deformity. So it's not the corn, it's the bony problem that causes it. And so usually it's a hammer toe. So the hammer toe with the knuckle sticking up in the air, or it might be bony prominences between the toes. So when the toes are crowded in the shoes, they rub together and make a soft corn between the toe. Sometimes it involves a bunion deformity where the big toe is pressing on the second toe and you get a corn in between the toes there. So we will discuss how to treat all that. And what usually causes the corn is the friction of the shoe or the pressure inside the shoe. So one way to treat it is just going barefoot all the time, but in our modern world, it's not practical to do so or healthy or safe to do so. So we have to learn how to deal with our shoes. So I'm going to show you what to look for in your shoes. So basically what you need to look for in your shoes, if it's wide enough or tall enough to accommodate your forefoot and those hammer toe deformities. So I'm going to show you how to look for that. So basically you take your insole out of your shoe and put your foot on top of it and just check to see if you're not overhanging the insole. And on mine here, it looks like I just fit. Also, the upper needs to be stretchy and tall. You can see how it stretches here. Here's my flats, and you can see that this doesn't stretch at all, which would put a lot of pressure on your hammer toes. This shows the difference in height of the toe box. Okay, so next, after you know that you have enough room in your toe box to accommodate the corn, I recommend softening it. You can soak it. Usually I recommend like saturated gauze pad with water or a washcloth. Let it sit on there about 15 minutes. It'll get soft. Or you can use 20% urea or 40% urea. So 20% urea will soften hyperkeratosis, which is the corn or the dead skin buildup. And 20% when it's a little bit thinner or softer, because urea, it can get over aggressive, or 40% if it's a thick hard one. You got to be careful with this because you do not want to get any urea cream with salicylic acid in it, because salicylic acid is very strong. It can eat a hole in the skin and cause a sore, especially for those that are diabetic with low circulation or numb feet, like so decreased blood flow to the foot, diabetic, numb foot. You do not want to use anything with salicylic acid in it because it could cause a sore that won't heal and turn into infection and end up with a toe amputation. And I've had to do that for patients that have used those medicated corn pads or the salicylic acid for treating corns on their toes. So please don't ever use salicylic acid. You have to use it with cautions if you're young and healthy with no medical problems. So the medicated pads or the corn plasters have the salicylic acid in, so you have to use it exactly as it's instructed. Normally, I tell all my patients never to use anything with salicylic acid because the skin on the toe is very thin and it can become irritated really easily with the salicylic acid. So 20% urea, 40% urea, you can get it on Amazon. I'll put the link in the show notes. And that does great to help soften that corn. And the harder it gets is the worse it hurts. So you got to get it soft. All right, so next thing is using an emery board to reduce the thickness if it's thick. So I don't recommend using anything sharp because, like I said, the skin is very thin on the toe. There's not much blood flow down there. It's really easy to hurt yourself. So just emery board once a week and just get it down. You don't want to get overzealous. Remember that the corn is there as a protection, so you don't want to get it the whole way down. Leave a couple layers there for protection, and do not use anything sharp. So anyway, next we have padding it off. So there's all kinds of pads that can be used. I'm going to leave you some links in the show notes. Anything over the counter I have found is very flimsy and doesn't really hold up very well. So I like using aperture pads, non-medicated aperture pads that are adhesive felt, and they work the best. And I'm going to show you how to put that on here in a minute. There's also CREST pads, and they kind of lift the toes up, and CREST pads are great for corns on the end of the toe. There's also spacers that help with the bunion and hammer toe type corns. So the spacers will help too. And there's also silicone toe sleeves to help with friction between the toes and whatnot. So, all right, so I'm going to show you how to put that pad on.
This is an 1/8 of an inch adhesive felt. It's an aperture pad, so you put the knuckle in the center of that hole there. It's sticky, and so you find where you want to put it. And I'm going to put it right on that joint there, that knuckle, and you put the little hole around the knuckle there and stick it on. And usually doesn't want to stay put, so I use paper tape. This is paper tape, and it'll keep it secure. You also can get this on Amazon, and it's good because it won't irritate the skin. You just leave these pads on during the day, and then you take them off at night so your skin doesn't get irritated. So that'll hold it nice and secure, and it won't be irritating because that tape is real nice. It just moves with the skin and doesn't irritate.
Okay, and finally, for conservative treatment, the thing that hurts you the most is the inflammation from the corn. So the corn is real hard like a rock. It presses on all the soft tissue there and gets it all irritated and inflamed. So if it looks pink and it's warm and a little bit swollen around the corn, that means the soft tissue around it's inflamed. And so if that's the case, I recommend to my patients they use a little bit of Voltaren gel there a couple times a day. You got to decrease the dosage on there, and I'm going to show you how to do this. And you can use this when you're not allergic.
Here's my well-worn tube of Voltaren gel. It's over the counter. You just use a little tiny bit, I'd say 1/10 of the normal dose, and just put it on whatever knuckle is bothering you there and just rub it in real good. And it gets everywhere, obviously, but it'll help.
Okay, and sometimes if your inflammation is very bad and hurting a lot, then your podiatrist can put a little bit of steroid under there and it'll make it feel great. So that's one thing you could do. Another thing, if you go to the podiatrist, they can debride it out really well, and they use a scalpel to do so. And remember that the corn is dead skin. There's no little nerve endings up in there, so it's not going to hurt. The podiatrist they're great about digging out those corns without causing pain. So that would be helpful. All right, now lastly, how do we get rid of it for good so it doesn't come back? And definitive treatment treats the root cause. And remember, we said the root cause was the forefoot deformity. Normally it's a hammer toe, so it's bony, and the only way to fix it is with surgery. So there's 4 different types of hammer toes, and it depends on what kind of hammer toe you have. Will dictate what kind of procedure your foot surgeon will use. Also, within those categories, there's a flexible or rigid deformity, and your podiatrist will determine what kind of deformity you have. So in general, if it's flexible, it means you can use your fingers and straighten it out easily. If it's rigid, it doesn't straighten out. So when it's flexible, you might be able to get away with just soft tissue procedures, and those heal faster. A popular one is percutaneous flexor tenotomy in the office, and this only can be done with a real flexible claw toe deformity. And the claw toe is basically your long flexor tendon underneath the toe pulling the toe back towards your foot. And what the foot surgeon will do, that you can have it done in the office, and they numb your toe and use the 18 gauge needle right where the toe meets the foot, and they sever the tendon underneath there. You don't have an open incision, which is great. So then you don't need to take care of an incision. The recovery time's a lot shorter, but that's a very, very small percentage of toes that can be corrected that way. You also can have a flexor tendon transfer, where you take the flexor tendons on the bottom of the toe, put them on the top to pull the toe down. And lastly, there are the bony hammer toe procedures. Now, hammer toes, you'd be surprised, they can be very complicated. So there's a lot of soft tissue contraction, there's a lot of tendon involvement. So the foot surgeon will have to evaluate all that and discuss with you what kind of procedure it needs to be done. So and the pros and cons of each, and then you both can decide what you need to have done. So, and basically, just as a broad overview, there's two different types. One is what we call an arthroplasty, which is just removing the knuckle out, and that'll help remove that the place where the toe rubs in your shoe and causes the hammer toe. And normally they'll hold it straight with a wire for a little while. And this, the recovery time's around like 4 weeks. But the downside with that is the hammer toe can come back in time, or the procedure might not work at all. But it's a nice procedure, and it's used a lot. The other type of procedure is a fusion procedure. So that's where you take out the joint where that knuckle's sticking up in the air. So you take out the joint and fuse those two bones together, and you can either have it held with a wire that gets removed, or a fancy expensive implant. And that procedure I like the best, because I know the hammer toe is not going to come back. The downside to that is that there's a longer recovery, and you have to stay off your foot so those bones can heal together. So that's more of a longer recovery, like 6 to 8 weeks. And so there you have it. There's all your treatment for your corns, and I hope this helps you. There is hope that it can go away. The treatments I discussed in the episode should help you right away as well. If you like this episode, please like and subscribe. I'd appreciate it very much. Thank you. We'll see you next time. Hey, thanks so much for watching today. If you learned anything, or if I've helped you at all, please like and subscribe to my channel, and please leave me comments, and I'll answer any questions that you have. If you have any topics you'd like me to cover, please leave that in the comments as well, and I'll do an episode on that in the future. And thanks so much. We'll see you next time.
This is the full reading of the disclaimer. This video is not intended to diagnose, treat, or prevent any disease, disorder, or condition. It is for informational purposes only and does not constitute medical advice, nor is it intended to replace medical advice. This video does not constitute a doctor-patient relationship